In today's podcast, I'm going to discuss autism spectrum disorder and stem cell treatment and exosome treatment of it. So, what is autism spectrum disorder and why is it called spectrum disorder? The reason is that the symptoms are variegated amongst different people with the entity. They frequently involve behavioral traits, social withdrawal, social awkwardness, verbal traits, delayed speech or lack of speech. There are gut issues in many people. Some patients have seizures, sleep disorders, and others. The disorder preponderantly affects boys rather than girls. It usually manifests early in life, in early childhood, although onset is somewhat variable. The cause is really unknown. We believe that it probably has to involve the immune system in one way or another for several reasons. First of all, in investigating this disorder, we have a file of about 70 different papers that show some sort of an immune abnormality. This is not classic autoimmune disorder situation like MS or rheumatoid arthritis, wherein the body produces antibodies that attack its own tissue, but abnormalities of the immune system are frequently seen. And indeed, if you were to try to figure out what causes it, there are really only 5 causes of essentially all human disorders. The others are degenerative, traumatic, infectious, and neoplastic, neoplastic being tumors. And it is clear that autism is not any of those. So in one way or another, we think the immune system has to be involved. The other causes have been implicated. There was some very controversial connection to vaccines. There was a paper that seemed to cause this. The paper was debunked. But again, the spectrum, the shadow of the immune system looms largely over this. Sometimes it appears to occur after infectious disorders. But again, it's difficult to dissociate causality from temporal association. At our Stem Cell Institute, our goal is to bring stem cell treatment to those who need it. And we are very careful to try to avoid bringing or offering hope to the hopeless, as it were. So we don't offer stem cell treatment unless there is good evidence either from prior human work or from animal studies that it is likely to help. In the case of autism, people have provided stem cells for some years in a few studies which have shown some degree of efficacy, including at one well-known American university. Therefore, about 3 years ago, we endeavored to start a clinical trial of the use of stem cells for autism to see if we could help this disorder. The disorder is difficult on the patients. There are many treatments that help a little, but there hasn't really been found a specific treatment that helps. Behavioral counseling and therapy is often very helpful. The gut has been implicated, and there have been various types of treatment for the gut, including fecal transplants, probiotics, and other entities to help that. Heavy metals have been implicated, and people have tried chelation with some success, but really nothing that has been found in most cases to substantially arrest or reverse the disorder. In fact, in our reading of the literature, it was our impression that stem cell treatment appeared to be perhaps the most efficacious treatment, and this is further amplified by the fact that there really have not been found any downsides to using stem cell treatment. Properly done, it is safe without side effects, and furthermore, repeat treatment has seemed to help. So therefore, we endeavored to provide a clinical trial. While there has been some work done in the United States, regulatory restrictions make it expensive to provide these trials. There doesn't tend to be much funding for these trials because the entities that usually fund these trials, which are pharmaceutical companies, haven't really found a drug that would be likely to help that would warrant them funding it. We, however, have a stem cell institute in the island nation of Antigua where we have full licensure to perform stem cell treatment. We use stem cells from a tissue bank in the United States. It's a lab called Vitro Biopharma. They're independent, I'm independent. I use their stem cells and exosomes because I believe that they're the best and most reliably produced, in my opinion, anywhere in the world. Indeed, these cells have been approved by the FDA in numerous occasions for use in humans with what's called compassionate use, and we've participated in this. The point being that the FDA has reviewed their manufacturing and found it to be safe and reliable. The problem arises in getting funding for a study to be done in the United States. However, in Antigua, we have full licensure and are able to be doing studies there. All patients treated have outcomes reported to the FDA. This treatment has been extraordinarily safe in our hands and with all patients treated with these stem cells with no serious adverse events in anyone ever treated. The treatment of autism using stem cells involves simple intravenous treatment. Now, it's interesting, and I've discussed in other podcasts, how other neurocognitive disorders such as ALS, Alzheimer's, Parkinson's disease, Lewy body dementia, have not really had much success with intravenous treatment, to which we've attributed to the blood-brain barrier. And by other means, we are achieving success by passing it. However, autism is one disorder that is clearly oriented in the brain in which intravenous treatment has helped. This simplifies treatment, as simple intravenous treatment is not difficult in general. It can be a little complicated in autistic people because it involves starting an IV, and many of these patients don't really like to be bothered. Often they're fine if left alone, but if you start an IV, then they can become upset. So for many of these patients, we have needed to use gentle sedation, not full anesthesia, but sedation. In many other patients, we haven't. We also strive to get objective confirmation of treatment whenever we treat. And so we endeavored to have Dr. Tim Royer, a world-renowned neuropsychologist and EEG expert, to do EEGs where we could on these patients before and after to see if we can identify differences. We have a clinical series of 10 patients that we've published in a good medical journal that has shown good efficacy. We can't do EEGs with sedation, so we couldn't do EEGs in most patients, but we had 3 patients who were fine with IVs without sedation, and we used EEGs before and after in them. We've had good behavioral response. Before I get into that, though, let me just describe the EEG responses. The EEG that's used is a fairly simple EEG, which has diodes, and this is painless, it's non-invasive, over 3 areas of the brain. Each of these areas has 3 different kinds of measurements. So each patient had essentially 9 measurements of their brain. Of these 9 measurements, in 8 of the 9, there were found to be substantial improvements in the EEGs afterward as compared to before. In another podcast, we're going to have Dr. Royer explain his results in more detail, but I will tell you that one of the things that was found is an increase in what are called theta waves from the parasympathetic nervous system. These are calmness waves, and when there are more theta waves, people are generally calmer, they tend to sleep better. And it is characteristic of these EEGs that the brains of these patients did not appear to be calm before, but after treatment, almost all the measurements showed increased theta waves and greater calmness after this was done. Regarding behavioral results, we had improvement in almost all of these patients. We had one patient who only improved for a month and then regressed. We had another who had dramatic improvement for 10 months and then regressed. The others improved and have stayed substantially improved. Many of these patients have come back for repeat treatment, and we have seen further incremental treatment. Now, and improvement. Now, the kinds of improvement have varied. We had one patient, for example, who did not improve verbally, but had profound sleep issues wherein he had to take sleep medicine almost every night, and he almost never slept through the night. This was difficult on the patient. It was also quite difficult on the family. After treatment of this patient, he almost immediately had dramatic improvement in sleep, such that he sleeps through the night consistently now and without sleep medicines. And This is also useful because these medicines can have other side effects, which now did not appear to be the case. This family came back for repeat treatment to see if they could get even greater improvement. We have had other patients where their verbalization increased. We have had patients where their other behaviors increased. We had at least one patient, one of our first patients, who had absence seizures consistently that stopped almost completely on the day of treatment and have remained remarkably diminished years afterward. So these treatments have been ongoing. We do not have as great an amount of success as we would like, but we have had substantial success, in our opinion, probably more consistent than with any other modality of treatment. Patients have been able to diminish medications. Patients keep up other therapies. In another podcast, I've mentioned our work with exosomes. Exosomes are small vesicles that exist within stem cells. They are much smaller than stem cells, about 1,000th as big, and they carry much of the medicine of stem cells. We are using exosomes with neurocognitive disorders such as Parkinson's disease, Lewy body dementia, ALS, Alzheimer's disease, and having quite remarkable success. There have been descriptions of these, not so much in the literature, but from commercial accounts of these being used elsewhere with autism. And we have recently started adding the use of exosomes to stem cells. The theory is that they're smaller and that they can get into the brain better. We're not sure. There's clearly no downside, and it is too early for us to tell whether stem cells plus exosomes are better than stem cells alone. But exosomes can be engineered to be more potent, and we think this is a fruitful area for further study. Regarding the tissue bank, this is Vitro Biopharma in Golden, Colorado. They are FDA regulated. They have had no serious adverse events with use in any patients, either with us or with them. Because we have licensure in Antigua, we are allowed by the FDA to use them there. And indeed, every patient treated by us, and there have been many hundreds, has a report sent to the FDA. And there have been no serious adverse events of any kind. The autistic patients haven't had any problems. We, again, have to use sedation and this has been well tolerated. This is not general anesthetic. It's usually just giving them some drops to swallow, or if they won't do that, using a mask to have them breathe something gently to allow the IV to be put in and the treatment to be given. The treatment is relatively rapid, usually under an hour of intravenous infusion, and has been well tolerated. The patients have seen no side effects. Some of the patients are very energetic right afterwards. Some of the patients sleep better right away. We do this in the island nation of Antigua, as I mentioned, for reasons of licensure, and patients can come one day, have treatment the next day, go home the day after that. All the while this is going on, there are other research efforts going on to try to identify exactly where in the brain or why in the brain this occurs. We use allogeneic stem cells, meaning they're from somebody else, rather than autologous stem cells, meaning from you, for a variety of reasons. The process of obtaining stem cells from our tissue bank involves ladies in Golden, Colorado, where the tissue bank, Vitro Biopharma, is located, donating umbilical cords after term cesarean sections. The donors are tested, the cells are tested, the DNA is tested. Actually, all of the donors have not even had COVID nor the COVID vaccine. Cells are isolated and they're expanded in culture and then frozen. We use these cells directly. While these cells are being expanded, they give off exosomes and growth factors into what's called a secretome. We call this exosome for short, but it's really a little more than that. And it is the secretome, it is also called conditioned medium, or just exosomes for short, that is what we have used. Exosomes are very interesting because they can be engineered. They can be concentrated. The potential exists to obtain exosomes not just from simple umbilical, what are called mesenchymal stem cells, but from neural stem cells. And Vitro Biopharma is in the process of growing these cells, obtaining the secretome, and after animal testing, we hope to try these in patients, not just autistic patients, but other patients. And we think going forward, this is quite promising. Exosomes are less expensive than stem cells, whereas stem cells have to be maintained at 196 degrees below zero. Exosomes need to be frozen, but it's easier to freeze something than it is to put it in a liquid nitrogen freezer. So the future for using exosomes is bright. Again, whether it will significantly enhance our stem cell work, we're not exactly sure. We're continuing to work. We've treated many other patients. All patients that we treat are part of a clinical trial that's approved by our federally approved institutional review board, and they're followed up closely for years to see just how well the treatment is working, whether the result attenuates, and how people do over time. There are numerous studies in the literature, several of which we have written from our institute, showing that stem cells are not associated with serious adverse events, and as I mentioned, we have not seen any. I mentioned that we are using allogeneic cells instead of autologous for several reasons, and I've described to you a little bit about how the supply chain works. So what are the reasons to use these cells? For one, these are very young cells. They are not embryonal, they are not fetal, there's no ethical concerns, they have nothing to do with abortions. They are what are called broadly adult stem cells, but because they are young, they are metabolically more active than cells that come from someone who is older. Whether this makes a difference clinically is not entirely clear. We think that it likely does. The other large reasons to use them are, first of all, to use your own tissue. It becomes necessary to remove fat from the patient by a procedure called lipoaspiration or liposuction. This is it's safe, but it's an invasive procedure, and in an autistic patient, it would require probably a general anesthetic, and then the cells have to get grown and then get put back later. It also happens that regarding culturing, using different cells from different people requires extra precautions in culturing, and it makes the culturing more expensive. So using your own tissue rather than these allogeneic cells winds up making the tissue more expensive. And when you add on to that the cells are probably less active, and there's no evidence that they're more effective, there just becomes really no reason to do this. And this is why, by and large, the treatment is done with allogeneic cells. The question obviously arises, well, if these cells are from somebody else, are they rejected? And the answer is because these cells lack HLA type 2 antigens, they're not. The body recognizes them as foreign and actually destroys them over a period of time. We don't know how long that is, probably several weeks to several months, but the cells are destroyed. They don't stick around forever, but they do last long enough to do a lot of good. They do this, we believe, by secreting what are called anti-inflammatory cytokines. We think these cytokines help quiet these unhappy neurons in the autistic people's brains. There are growth factors which we think help to heal them. And then the exosomes get into the cells and actually get into mitochondria in the cells. Now, in many neurodegenerative disorders like ALS, Parkinson's, Alzheimer's, the mitochondria have been implicated. We don't exactly know in autism whether they're involved. It's possible that this is a mechanism, but it points out how much more that biologic answers like this are able to do relative to pharmacologic ones. Our pharma industry produces great medicines that do great things, but in general, they're targeting one particular area, and they have to be tested for a long period of time regarding that area. Dealing with a biologic system and stem cells, which are natural, they're how nature heals us, they're nature's policemen, more closely mimics what happens in nature when usually our biologic answers are multifactorial and can help in multiple ways. There is active ongoing research to try to figure out exactly how, and there is potential to combine stem cells with other kinds of treatment. So we're really at the beginning of this journey, not at the end of it. Work in this area is done globally. We are part of that process. We're fortunate to have the capacity because of our Stem Cell Institute and because of our affiliation with Vitro Biopharma, which, by the way, is independent from me. They don't in any way pay me. I just use their cells and their tissue because I believe that they're the finest available. So going forward, we continue to do clinical research. The exosome treatment and permutations on that are just the latest in that discussion. The question can come up, well, why not inject these into the brain or by lumbar puncture, into the nervous system? And the reason why not to is that it's possible to do this, but it's invasive, it's difficult. In these young people, it would require a general anesthetic. And we're fortunate that the treatments that have been done just haven't needed to have that happen. And in other areas where so-called intrathecal by lumbar puncture has been compared to intravenous, often the differences aren't that great. So on a risk-benefit basis, we just don't think that it's justified to subject these usually young patients to an invasive procedure without some evidence from animal studies or elsewhere of increased efficacy, which at the present time has not been forthcoming. We have better success with some disorders than others with stem cell treatment. Our ideal patients for stem cell treatment are patients with a fairly severe disorder, significantly disruptive disorder, where other targeted therapies have not been terrifically effective and where stem cells have been consistently effective. So autism spectrum disorder fits all three of those criteria. We treat people in Antigua. We also have a center in Athens and are opening one in the Far East. We see people from very far away. We recently had a patient come from Mongolia. We had another patient come from the UK. These patients in Antigua, interestingly, have been found to tolerate treatment there well. We had one or two patients from New York City, for example, who described that their autistic children were calmer and more comfortable in Antigua with the ocean nearby and the relatively quiet culture compared to the more frenetic pace in New York City. So it has turned out to be a good place to treat people, and the patients and families, we think, have been happy. So we are happy to interview anybody who's interested in treatment. For those who may be or who have questions in general, our institute can be reached at a phone number, which I will give you now. It's available elsewhere. It's 847-699-6810, 847-699-6810. That is to the Prodromos Stem Cell Institute, PSCI. And our website is care, C-A-R-E, at thepsci.com. So that's care at thepsci.com. This institute provides treatment. Our sister institute, the Foundation for Regenerative Medicine, is a 501c3 not-profit foundation that employs 3 full-time researchers who follow up all these patients. We give patients rating forms before and after so that we can obtain objective confirmation. We try to practice evidence-based medicine, which is expensive and difficult, but we think that if one is on the cutting edge of this, that it's an obligation. We've produced 13 papers just in the last 2 years from our institute. 11 of them are published, 2 more are in peer review, and we have many more in process. We listen very closely to our patients because their observations are important to us in an area where there is a relative paucity of data. So again, this is an area that is exciting to us. It is distressing that it has increased as much as it has, and we are hopeful that further research in that area can try to figure out a little more why it's increasing, and look at perhaps environmental causes which are likely involved that can be identified and mitigated so that we're dealing in a situation where we can hopefully prevent this disorder. In the meantime, we're doing our best to treat it, to mitigate the disruptions and the costs to families, and have been so far excited by the success that we have had.